I am Dr. Jay Hitson with Blue Umbrella Medical Center, innovative, integrated health solutions, all under one blue umbrella. One of the things that we have been discussing amongst all of the providers here lately is how it's interesting. Let's say somebody wants to have a knee operation, how the insurance companies actually mandate that you try all of these conservative measures first before they will allow or approve the more advanced operation or the more dangerous protocols. And we were talking about how, what if that was actually the standard for all of the more invasive measures in healthcare? So, like, for instance, what if it was where before you could go on high blood pressure medication or, cholesterol medication or diabetes medication, what if you had to prove first that conservative measures like lifestyle choices didn't work, and then you could get your medications? How would that change the nation? How would that change the entire field of healthcare? And we're pretty sure it would radically alter the landscape and the health of this nation if before you could get your drugs, before you could get your prescription medications, you had to prove that lifestyle, diet, exercise, the fundamentals didn't work for you. Because one of the things that we are finding day in, day out is how amazing the average patient does respond to lifestyle changes. And it's not like it's this radical, you have to give up everything and every food you have ever loved, you can never eat again, and you're working out for hours a day. It's nothing like that. Very simple changes make huge differences. And not only do we see differences in, the markers, blood pressure coming down, cholesterol levels getting into normal ranges, A1Cs under control. Not only do we see these markers, but the patients are reporting how much better they feel, they have more energy, and they actually feel like they have more life. More vitality is the word that I love the most. And, that's what's really exciting about this. Now, as we debate this amongst ourselves and the providers and the doctors and inside this office and outside, the same issue gets posed. Patients won't do it. We could spend the time telling them these things, but they won't do it. So why waste the time? And I agree that there are a percentage of patients, there's a percentage of the population who want their magic pill. They don't care about the side effects, and they won't. They will not make any changes. I actually did sit across from a woman a few months ago who we were talking about her diabetes, that it was out of control, getting into the list of medications, and she said, well, frankly, I'm not going to give up my M&Ms. So if whatever you're talking about involves me not having M&Ms, then I just rather, and she actually said these words, I would just rather die. Okay. But that's actually, I feel, more rare than it is. I believe that is more of the exception than the rule. I believe there's a huge percentage of the population. I believe that there is a overwhelming number of individuals who want to live a fantastic life full of health and vitality and are willing to do the measures it takes to enjoy their life and to enjoy feeling good and aging gracefully and having the physical and mental stamina that they long for, even getting into, advanced years. I believe that there is a huge percentage that wants that. And if given the tools, they will do it. And especially if they're given the tools and then they're given the right environment to apply those tools. I'm a huge fan of atomic habits and the power of habit, and how you can start building and habit stacking positive habits in a way that, let me give you a perfect example. Brushing your teeth. Brushing your teeth is a positive habit. It is something that you do on a very regular basis with very, very little effort. Well, you can start to stack and power stack your day so that making these good choices and doing these right things is as effortless as brushing your teeth. And that's how we have decided to approach things here at Blue Umbrella, is using this process of habit stacking, creating these power habits that one on top of the other lead you to this very effortless but extremely effective lifestyle that not only makes you feel better in the moment and day in, day out, but actually reverses a lot of these different disease processes. Now, how we have to do that is through a process called medical nutrition therapy. Diet is huge. You can't outrun a good diet. So there's no amount of exercise that can overcome a bad diet. So, nutrition is a huge part. And we use, registered dietitian to guide people through those particular choices, because everybody's different. And if you go on, you keep going through YouTube and trying to YouTube your way to a healthy diet, I'm not saying you're not going to stumble on some good stuff, but in general, especially by the time we're over 40, we have so many different contributing factors to our life. When you're young, the fundamentals are pretty straightforward, but as we've aged, we've been exposed to so many different things by that point that one size fits all doesn't fit anymore, not at those ages. So we have to go through, we use biomarkers, we use blood tests to know where people are at. We don't guess, we're very scientific in our approach. We use panels to find out what those markers are, what do we need to be doing specifically for this individual, and then start the process of stacking the habits. Now, again, it's not something that you can do all at once, one at a time, over the course of days and weeks and months. And a lot of us, again, who are getting older, we know how these things have a way, decades later, we see the effects. And here's the thing, if you're listening to this and you're coming into your mid 30s, 40s, 50s, this is the time you have to make these decisions. You can't decide in your 80s that now's the time to get healthy. You really have to decide in your 30s, 40s, and 50s how your 60s, 70s, and 80s will look. That's the key. So again, our approach, what we have found to be effective, is medical nutrition therapy, working with the individual, customizing what needs to be done, continuing to build up better levels, because as soon as you peel back one layer and, okay, we get the diabetes under control, or we get the weight under control, or we get the cholesterol under control, well, then sometimes there's another layer, like, oh, okay, now we still need to get some better hormone balance in order to have that super high level of energy, or that thyroid, it's just not quite there in order to have that mental stamina that somebody's looking for. And there's obviously, with stress levels and cortisol levels and nutritional balances, there's just so many different factors. And we have found that, working with people over time to peel back the layers. But the question that we ask ourselves continually is, if everybody went this way, or even a greater percentage of the American population would start to treat their health this way, that before they go to the pill, before they go to the drug, before they go to the invasive procedure, they have to prove not only to their physician, but to themselves, that they can't do it on their own. That their body is too far gone, there's too much damage, there's too strong of another component to overcome. What would this nation look like, and what would our healthcare crisis look like? It's a very, very interesting thought. So we believe in just a different way of looking at healthcare. Again, we are looking for health solutions. We're not looking to cover up the problem. And that's what we're about here at Blue Umbrella Medical Center. I'm Dr. J. Hitson.